Well, medical experts say we are already starting to see it, and it is going to get worse. We are talking about the rising cost of health care and prescription medications. And we are here with our daytime doc, Dr. Tom Rogers, to give us some insight and sort of help prepare us for what people are thinking.
Well, regardless of what happens with the election, we know that premiums in January are going to go up. We've already had a lot of insurance companies that are dropping out of the Affordable Care Act. So you can guarantee that your premiums are going to go up and you're going to get less coverage. We all know about the cost of medicine. We've talked about the EpiPen and all that, how that skyrocketed. So really, and even in Medicare, I mean, navigating Medicare is a nightmare. I've had 2 patients this week tell me that how much they had to pay for their Medicare, which I thought was kind of basically free, but it's really not. It's very complex. You really need to talk to somebody who knows a lot about it. The persons that really gets messed with, I think, is the people that pay for private insurance. Their deductibles are so high and their premiums are going to at least go up by 30 to 50% in 2 months that they're going to have to start looking at taking care of themselves a little better, I think.
Well, and you talked about the deductible, and it's interesting. Everything resets in that calendar year. You just about get to that point where it looks like somebody's going to help you, and then you start back over at zero. So you were saying it's so important to take charge.
That's right. You know, a lot of people that have met their deductible for this year are scrambling to get their elective surgeries done. You know, my brother's a surgeon. He says he's really busy during the holidays because everybody wants that procedure done, that gallbladder hernia that wasn't urgent, to get it done. But you need to really start looking at those things for the new year. Medicaid, TennCare is what that is. That is probably the, I hate to say it, but almost the best coverage of anything. It's almost like carte blanche. But the people that are actually having to pay for their insurance are the ones that are really kind of getting screwed.
And you said one of the things that we might want to look at is the health savings account, the HSA, which continues to be pretty popular.
That's my favorite form of insurance, is the medical savings account, where you can put money in there and kind of use it at your discretion. In other words, you need to know what you're paying for and take it out. And if not, you can save it. It's not like it's wasted, and it can carry over year by year. They've changed the law on that, and in my opinion, by far the best way to go. If you're healthy, if you have a chronic illness, you know, you may want to stick with what you have, but look at your plan.
And you said too, it's important to shop around. I think a lot of people, when they get a prescription, they just assume that that is the cost of a prescription, but different places will do different amounts.
That's exactly right. You know, that's why 10 years ago I got rid of all insurance in my practice. You can still file it through the labs if you want, or I'll give you a claim form, but I do not like dealing with insurance companies, you know, 10, 15 times a day, try to talk them into doing something, filling out codes. You need to get what you're paying for, and that's why I did that, and it's been very successful.
So shop around, be prepared, and take charge.
Right. Take care of your own health, be your own doctor.
Certainly some great information as we get ready to enter into a new year, and definite changes ahead.
Exactly.
Dr. Rogers, thanks so much for joining us.
Thank you.
For more information, you can always check out their website or stop by one of their offices. It is performancemedicine.net.